This section looks at the external parts of the female genitalia. I'm now going to run through some of the key features of the female external genitalia, and that includes the labia majora, the labia minora, the urethral orifice and the hymen, the mons pubis, the vestibule and the clitoris. So the labia majora contains sweat and sebaceous glands, which produce lubricating secretions, and during puberty hair starts to appear on the labia majora. This structure can be compared to the scrotum in males. Just inside of the labia majora is the labia minora, and this surrounds the openings to the vagina and urethra. It has a pink colour due to having a rich blood supply. The vestibule contains the urinary and vaginal orifices, along with the openings of the greater and lesser vestibular glands. On the superior aspect, we can see the mons pubis, and this is a massive subcutaneous adipose tissue anterior to the pubic symphysis and bears the majority of the pubic hair. The clitoris has a rich supply of autonomic efferent motor nerve endings via the cavernosal nerve of the clitoris and is highly sensitive to sexual stimulation. It has no urinary role and it is almost entirely internal. Now we're going to look at female genital mutilation. Female genital mutilation is any form or procedure involving partial or total removal of the external female genitalia. And this practice is a somewhat controversial practice and is currently illegal in the UK. I'm now going to run through some of the different types of FGM. And clitoridectomy is type 1, and this involves removal of the clitoris, complete excision of the clitoris. Type 2 also involves excision, but is a partial total removal of the clitoris and labia minora as well. Type 3, infibulation. This is the practice of excising the labia and clitoris and stitching the edges of the vulva together to prevent sexual intercourse. Type 4 involves burning or cutting the clitoris and therefore leaving the vaginal opening scarred. In terms of the problems of FGM, as we mentioned, it's a very controversial act. It can cause acute hemorrhage, lead to shock, sepsis, blood-borne infections, and death. Sexual difficulties and fertility issues are not uncommon, and fear of childbirth and psychological damage and PTSD are understandably common after having been subject to such an act. It is illegal in the UK, and anyone known to have been involved in doing such an act can be subject to up to 14 years in jail.